Hello guys, today I will be sharing with you some information about fluoroscopy. Why did I choose fluoroscopy? Mostly it was because we didn't learn much about it specifically in class yet. I thought that classmates may also have an interest in learning about other imaging modalities, and in the future it will allow me to make an educated decision about whether or not I would like to specialize in this specific imaging modality. Fluoroscopy and the live image. So fluoroscopy is a type of medical imaging that uses radiation to look into the human body. So in that aspect, it's very similar to what we've been learning about X-rays. Fluoroscopy produces a live image for viewing, and it's mostly of organ system functions or bodily functions while they are in use, which is very important. An example of this would be the swallow test, which there is a picture of that on the right-hand side of the screen. Going up here from A to F, you can see that the contrast agent, which basically is anything that will show up well on a fluoroscopy procedure. You can see it moving down the person's mouth and throat, and then it kind of cuts off. But they use it to see how the person is able to swallow and how those parts of their body are functioning while they are being used. There's really nothing else like it that will show medical professionals how things move through the body in real time. Like I said, contrast agents are used pretty frequently, and they are used to clearly define bodily structures. However, the use of contrast agents can cause cardiac arrest in some patients. So the medical team that is in the room and part of the procedure should be aware of this, and if anything were to happen, they would need to respond very rapidly. In fluoroscopy, there is a constant stream of X-rays and/or radiation that is passing through the patient during the procedure. And the unique capabilities can make fluoroscopy more practical than other imaging modalities, such as the swallow test. If you were taking an X-ray of someone, you wouldn't be able to see how that contrast is moving down the person's esophagus. Fluoroscopy versus X-ray. Fluoroscopy and X-ray actually share a lot of common traits, but they also have some distinct differences. The machines have similar components, but they are assembled differently. As you can see in the picture on the top right corner, we are used to the X-ray tube and generator being located above the patient, where in fluoroscopy they are located underneath the patient and the table, and they shoot upwards through the patient and into the rest of the machine. X-ray and fluoroscopy produce images differently. Fluoroscopy produces images with an inverted grayscale. So the two bottom pictures of the skull, the one on the left is a fluoroscopy image, and the one on the right is a regular traditional X-ray. You can see that fluoroscopy is inverted from what we are used to seeing as incoming X-ray techs. A real-time movie is created with fluoroscopy versus the still X-ray images, and the live image is a result of many single pictures taken with a high frame rate. That way the human eye can't really tell the difference between if it's a movie or a lot of still pictures, one after the other. Back to the machine components. The components that fluoroscopy and X-ray share include collimation, beam filtration, grid usage, image receptors, and an X-ray source and generator. Radiation dose in fluoroscopy tends to be relatively high compared to other modalities. In order to produce the live image, there has to be a continuous stream of radiation passing through the patient, which can either be pulsed or continuous. The patient dose is higher than in other modalities, as well as the occupational dose. This means that the shortest exposure time for any given procedure should be used to decrease patient and occupational dose. And a few reasons why the occupational dose is higher, as you can see from the picture, the operator, any doctors, or anyone else in the room is standing near the source of radiation or the X-ray beam. So they're not behind a protective wall with lead in it like we are. And the procedures tend to be longer, so the exposure time in X-rays is, a fraction of a second, where in fluoroscopy it's minutes, or, sometimes it could even be up to like an hour. It depends on the scope of the exam. Because there is a higher radiation dose for both patients and any medical personnel, radiation protection is of utmost importance. Although some operators choose not to wear their protective equipment, a 2004 survey states that 50% of respondents reported spinal problems due to the weight of lead shields. So if you're having back pain, you're probably less likely to want to protect yourself, since the radiation isn't going to immediately affect you. And also, back pain caused 33% of respondents to miss work due to back pain, caused primarily by long-time use of the heavy lead garments. So even though it can cause some minor health problems, it's better to protect yourself from the radiation, because over time that will accumulate and really negatively impact your health. Depending on the procedure, the medical team is exposed to higher doses of radiation, such as during orthopedic extremity nailing, which is depicted right up here. So you can see they're using tools to basically position bones back into where they're supposed to be. So that procedure can end up taking quite a long time. An area of greater concern is the worker's hands, according to a study led by the U.S. National Library of Medicine. They found that within the direct beam, the surgeon's hands were exposed to 100 times more radiation than that of the operator at 15 centimeters from the beam, which really isn't that far if you think about 15 centimeters, but it makes a huge difference. Also, radiation doses to trainees is shown to be higher than that of experienced operators. And that could be for various reasons, such as they're just inexperienced, or maybe they're overwhelmed, so they're forgetting to properly protect themselves. The use of protective equipment is necessary for all procedures in fluoroscopy to prevent these high doses to the medical team. As you can see, the bottom three pictures down here are examples of the lead garments that are used in fluoroscopic procedures. On the very left-hand side, there is a lead apron, which looks very similar to the one we are used to seeing in X-ray. However, the lead aprons used in fluoroscopy are complete wraparounds, so they leave very little space for exposure. So like under the arms here, there might be a little radiation that gets in there, but it fully wraps around the body and goes from the neckline all the way almost to their knees. Next is the lead glasses or goggles. Those are worn by medical personnel during fluoroscopy procedures to protect the sensitive tissues that are the eyes. And further over, you have the lead gloves, which are used anytime you're going to be in the direct beam or near the source of radiation. Radiation doses to hands, like I said before, are of utmost concern. So really going out of your way to make sure you have those on when you're near the source of radiation is very important. In conclusion, fluoroscopy is useful in viewing live images of bodily structures and functions, and also in placing objects or removing them from the body, such as with the orthopedic extremity nailing that I went over previously. Fluoroscopy uses longer exposure times, which means protection is vital in order to ensure that you are safe as well as coworkers and patients. To create the live image, there is a continuous X-ray beam passing through the patient and on to the image receptor, which then gets passed on to the monitor. Contrast agents are sometimes used to view how they travel through the body. An example of that, again, would be the swallow test on the first few slides. Fluoroscopy and X-ray share common traits, such as some of the components included in the machinery, but they also have distinct differences, such as their functions, capabilities, and how the machines are, I guess, put together. I hope that you guys enjoyed my PowerPoint, and hopefully it piqued an interest in fluoroscopy as a possible modality for specialization in the future. And these are my references.